Women and heart attacks, understanding the risks, symptoms, and prevention. Heart disease is a leading cause of death for women globally, and heart attacks in women often present heart attacks in women, including symptoms, risk factors, and preventative strategies, supplemented with the relevant understanding of the heart and women. Heart attacks occur when the flow of blood to the heart is blocked, usually by a buildup of fat, cholesterol, and other substances, forming a plaque in the coronary arteries. Both men and women are affected by heart attacks. The way in which they experience symptoms and outcomes and events can differ significantly. Risk factors specific to women. Women have several unique risk factors for heart disease, including, guess what? Menopause. The natural decline in reproductive hormones during menopause can increase LDL cholesterol, that's the bad cholesterol, and decrease the HDL cholesterol, the good cholesterol, and during pregnancy complications. Conditions such as gestational diabetes and preeclampsia during pregnancy can increase the risk of cardiovascular disease, autoimmune diseases. Women who are more likely to demonstrating the impact of hormonal changes, autoimmune diseases, and pregnancy related issues on women's cardiovascular health. Symptoms of heart attacks in women. Women often experience symptoms that are less recognized as being related to heart attack. Symptoms, like elephant sitting in your chest feeling, pain in the neck, jaw, shoulder, upper back, or abdomen. Women are more likely to have these atypical or pains that men don't have. The shortness of breath, the nausea, the lightheadedness. Women may have these symptoms without the chest pain. Fatigue. Some women have heart attacks and they feel extremely tired, even if they haven't been very active. So the symptoms presented in women versus men. This can illustrate the percentage of women and men reporting different symptoms during a heart attack. And they will emphasize the atypical presentations common in women. So, what's the diagnosis? The diagnosing a heart attack in women can be challenging due to the different symptoms and less typical presentation of that patient in the hospital. As a result, women are often diagnosed later than men, impacting their treatment outcomes. Treatments generally involve medication, lifestyle changes, and possibly procedures like angioplasty or surgery, depending on the severity. So, what are the preventative strategies for heart attacks in women? Number one, lifestyle changes, maintaining a healthy diet, regular exercise, quitting smoking, and reducing alcohol intake, doing regular screenings, and monitoring blood pressure, cholesterol, stress reducing activities like yoga, meditation, or therapy. So, what are the preventative strategies and their impact on heart health? This will actually go into the women. So, what's the age that most women should really start to be aware of heart attacks? So, women particularly should be aware starting in their mid 40s to early 50s, as this is often when the risk begins to increase. It's also when menopause occurs. This timing corresponds, therefore, with the menopausal changes which typically occur during this age range. Menopause can lead to shifts in hormonal levels, particularly a decrease in estrogen, which has been thought to help protect the heart. As estrogen levels decline, the risk of developing cardiovascular diseases, including heart attacks, increases. However, it's important to note that heart disease can affect younger women as well, especially those with risk factors such as high blood pressure, high cholesterol, diabetes, smoking, obesity, and a family history of heart disease. Women with complications of history during pregnancy, all of these gestational and preeclampsia diabetes can have they have to be more vigilant during this early age. Regular checkups that include monitoring blood pressure, cholesterol levels, and other potential risk factors should start in adulthood, ideally by the age of 20, as recommended by the American Heart Association. Early and regular screening helps in identifying risk factors early, which can be managed effectively to reduce the likelihood of a heart attack later in life. What should women never fail to do? And that's report as far as symptoms to their doctors. Women should never fail to report the following symptoms, and these are indicators of heart disease or impending heart attacks. Chest pains or discomfort, although it may always be severe and not severe, or the more prominent symptoms in women, any new or unusual chest pain or discomfort should be reported, especially if it's associated with exertion and it is relieved with rest. Shortness of breath, difficulty breathing, or shortness of breath without excursion. And that would occur alongside other symptoms like fatigue or chest discomfort. So if you exert yourself and it's really short of breath, you should be very serious about this side effect. Unusual fatigue, severe unexplained fatigue, or a sudden decrease in exercise tolerance can be a subtle sign of a heart attack. Pain in other areas of the upper body, symptoms such as pain in one or both of the arms, the back, the neck, the jaw, or the stomach. Nausea or vomiting. Women are more likely to experience nausea or vomiting as symptoms of a heart attack as compared to a man. Sweating, breaking out in a cold sweat for no apparent reason could also indicate a heart attack. Lightheadedness or dizziness, feeling faint or dizzy without a clear cause can be a sign of a heart attack, especially if accompanied by other symptoms. Heart palpitations, unusual fluttering or rapid heart rate that comes on suddenly should be reported, particularly if it's associated with any of the other symptoms. Therefore, it's crucial for women to communicate these symptoms promptly to their healthcare provider, as early detection or treatment can significantly improve outcomes in heart-related conditions. Even if the symptoms seem mild or vague, discussing them with a doctor is essential, as women often experience subtler symptoms than men before a heart attack. In conclusion, awareness of the unique aspects of a heart attack in women is essential for early diagnosis and effective treatment. By understanding the distinctive symptoms and risk factors, women can better advocate for their health, and healthcare providers can tailor their approaches for better patient outcomes. Thank you for watching, and bye for now.